Okay.
This is Sunny. Sunny is a 2-year-old spayed female mixed breed dog, and Sunny has some problems with her right hip. She has a lot of pain in her right hip, and she has lameness associated with that pain. She actually likes to bunny hop with both of her hind legs, but her left hip appears to be normal on x-rays. The right hip on x-rays has a deformity that we believe has to do with some problems with the blood supply to that hip, a disease called leg-calf-Perthes disease. And that's caused lysis of the hip bones, and it's caused them to fracture and break down, and it's causing her quite a bit of pain associated with that. So what we're going to do for her is we're going to remove the damaged pieces of bone from her hip, do an operation called a femoral head and neck excision, and that will remove the damaged portions of the bone that are causing her pain. She will then have some soft tissue interposed between those pieces of bone, and that will allow a false joint to be created. And this will give her a pain-free, very functional joint as she gets older, and allow her to return to some normal function in her hind legs. So the whole process here today is going to take about 2 to 3 hours of getting her prepared for surgery and having the operation. The initial recovery is about 2 weeks of rest. And then following that, we have physical therapy that will start with our local physical therapist, and the total recovery lasts somewhere about 2 to 3 months. It can take up to 6 months to get completely better, but on average about 2 to 3 months. So that's a fairly straightforward diagnosis, a fairly straightforward surgical intervention, and a very good prognosis with surgery. So we have high hopes for Sunny for getting better.